Hello future nurses, confused about electrolyte imbalances? In this video, let's make calcium imbalances, that is hypocalcemia and hypercalcemia, clear, including causes, clinical manifestations and management using easy mnemonics so that you never forget. So let's begin. Calcium. Normal level of calcium is 9 to 10.5 mg per deciliter. To remember, we know that symbol of calcium is Ca, and from C we have to remember contractions, muscles and nerves. That means calcium plays vital role in muscle contraction and nerve functions. Now, normal level of calcium is 9 to 10.5 mg per deciliter. Two conditions occur when calcium is out of balance, that is hypocalcemia or hypercalcemia. So let's discuss hypocalcemia. Hypocalcemia, a condition in which serum calcium level is less than 9 mg per deciliter. That means calcium level is below than its normal value, that is below than 9 mg per deciliter. Firstly, we will discuss the causes for hypocalcemia. We know that hypocalcemia is a condition in which there is low calcium. So the mnemonic for causes is low calcium. The conditions which causes hypocalcemia are related to the mnemonic low calcium. Let's discuss one by one. L. L stands for low parathyroid hormone. We know that parathyroid hormone is secreted by parathyroid gland, which is responsible to regulate calcium levels. So if there is decreased parathyroid hormone production, inadequate calcium levels regulation will be there, which leads to hypocalcemia. O stands for oral intake inadequate. If there is poor dietary intake of calcium rich foods or due to long term fasting, there is decreased calcium in the blood, and which leads to hypocalcemia. W, that is wound drainage, especially GI surgery. After any GI surgery, large amounts of calcium can be lost through continuous wound drainage or drainage of fluids, due to which the end result is low calcium in the body. C stands for celiac or Crohn's disease, that is malabsorption syndromes. Celiac and Crohn's disease are malabsorption syndrome. In these conditions, there is reduced absorption of calcium and vitamin D from the intestine, due to which hypocalcemia may occur. A stands for acute pancreatitis. Pancreatitis, if there is inflammation of pancreas, the calcium will bind with fatty acids, which lowers the calcium level in the blood. L stands for less or inadequate intake of vitamin D. We know that vitamin D is essential for calcium absorption. So, if there is deficiency of vitamin D, calcium absorption will not occur, which leads to hypocalcemia. C. Chronic kidney disease. Chronic kidney disease. Now, kidneys convert vitamin D to its active form. So, if this process is impaired, there is no vitamin D in its active form. So, low calcium absorption. So, hypocalcemia. I. Increased phosphorus. Phosphorus and calcium have inverse relationship. So if there is increased or high phosphorus level, so there will be low calcium level in the blood. U stands for using medication such as diuretics. Diuretics also like loop diuretics. They increase calcium excretion in the blood, leading to decreased calcium in the body. M stands for magnesium low. Low magnesium will impair the parathyroid hormone release from the parathyroid gland, sorry. So if there is low magnesium, impaired parathyroid hormone release, which leads to hypocalcemia. So these were the causes for hypocalcemia, which we can remember with the mnemonic low calcium, that is low parathyroid hormone, oral intake is inadequate, wound drainage, malabsorption syndromes, acute pancreatitis, less intake of vitamin D, chronic kidney disease, increased phosphorus, using any medications like diuretics, or low magnesium levels. Now, let's discuss the clinical manifestations of hypocalcemia. What signs and symptoms will appear if there is less calcium in the body? Mnemonic for Clinical manifestations is twitches. Now we know that calcium plays a role in muscle contraction and nerve function. So, if there is less calcium, muscle contraction and nerve function, both functions are impaired, which will cause regular muscle spasms because of neuromuscular excitability. So, the mnemonic to remember this is twitches. Let's discuss T. T stands for tetany. Tetany is a classic sign of hypocalcemia. Due to means hypocalcemia, decreased calcium in the blood, Troussea sign and Chvostek signs occur. And if these signs are positive, then that means it is a condition of hypocalcemia. W stands for weak bones, osteoporosis, or fractures. We know that calcium is very important for bones. So, if there is less calcium, osteoporosis or fracture risk is increased. I stands for irritability. As we know that due to low calcium, nervous system will become overexcited, due to which the person will be irritable, anxiety, confusion, or mood swings can occur. T. Tingling or numbness around mouth, fingers, toes. Tingling and numbness, that is paresthesia, will also happen because of the nerve function impairment due to low calcium level. C. Convulsions, confusion, cramps. These will occur because of the increased neuromuscular excitability, muscles contraction, which will cause muscle cramps, convulsions, and confusion. H stands for hypotension, hyperreflexia, and hyperactive bowel sound. Hypotension will occur due to reduced myocardial contractility. We know that calcium is important for muscle contraction. If there is less calcium, then heart muscles, that is myocardial contractility, will be impaired, due to which hypotension will occur. Hyperreflexia and hyperactive bowel sounds, that is hyperperistalsis, will also occur due to nerve or muscles excitability. E stands for ECG changes. Various ECG changes will occur due to hypocalcemia. S. Seizures, stridor, spasms. These severe means hypocalcemia can be life threatening because seizures may occur. So, these are the signs and symptoms that we will see in a person with hypocalcemia: tetany, weak bones, irritability, tingling or numbness, convulsions, confusion, cramps, hypotension, hyperreflexia, ECG changes, and seizures. Now, let's discuss the two signs of hypocalcemia that are Chvostek sign. First sign is Chvostek sign. Contraction of facial muscles in response to light tap over facial nerve. As you can see in the picture, if we will lightly tap over the facial nerve, the facial muscles will contract. This is a positive sign. If this occurs, that means this is a positive sign for hypocalcemia. And the second sign is Troussea's sign. Carpal spasm induced by inflating a blood pressure cuff. That means when we will take the blood pressure of the person and we will inflate the BP cuff, carpal spasm, as shown in the picture, the carpal spasms will occur. And if this spasms occur, then that means this is also a positive sign for hypocalcemia. So, whenever there is a condition of hypocalcemia, we have to remember these two signs, that is Chvostek sign and Troussea's sign. Let's discuss the ECG changes that occur due to hypocalcemia. Prolonged ST segment and prolonged QT interval. This is the normal ECG, as we can see the P wave, QRS complex, and the T wave. This is the ECG in the condition of hypocalcemia. As we can see, in case of hypocalcemia, the ST segment is prolonged and also the QT interval, that is as shown in the normal ECG, we can see the QT interval is shortened as compared to that in the hypocalcemia condition. So these two ECG changes, that is prolonged ST segment and prolonged QT interval, occur in case of hypocalcemia. Let's discuss the management, how we will manage the condition of hypocalcemia. If this is a condition of hypocalcemia, that means low calcium, then to treat this condition, we have to give calcium to the client. So, the management mnemonic for hypocalcemia is calcium because we have to give calcium to treat this condition. C stands for calcium supplements. Per oral or IV, we can give oral calcium, and along with calcium, we have to give vitamin D because vitamin D is essential for its absorption, or we can give calcium gluconate IV. A stands for assess airway and administer aluminum hydroxide. Airway, we have to assess airway because laryngospasm can occur or stridor, as we discussed in clinical manifestations, which can be life threatening. Aluminum hydroxide is given if the cause is high phosphorus, because in case of high phosphorus the calcium level was low, so if we will manage the high phosphorus levels, then calcium level can be maintained, and to manage that we can give aluminum hydroxide. L stands for look for ECG changes. We have to continuously monitor for ECG changes. Correct vitamin D deficiency. We know that this is vitamin D is essential for its absorption, so we have to correct vitamin D deficiency. IV calcium gluconate, initiate seizure precautions. Calcium gluconate we can give IV, and always calcium gluconate we will give slowly, means infusion slowly, or in the diluted form we can give. Initiate seizure precautions because if it is severe hypocalcemia, then seizures may occur. So we have to initiate seizure precautions. U stands for underlying cause treatment. Whatever is the cause for hypocalcemia, we have to treat that underlying cause. M stands for magnesium correction. Move patient carefully and monitor for signs of pathological fracture. We know that low magnesium will affect the parathyroid hormone release, so we have to correct the level of magnesium so that adequate parathyroid hormone is released, which will maintain the normal calcium levels. Move patient carefully and monitor for signs of pathological fracture. Due to low calcium, there is increased risk for developing of fractures in the patient, so we have to move patient carefully, and also we have to monitor for early signs of pathological fracture. So this is the management in the condition of hypocalcemia, that includes calcium supplements, assess airway, and administer aluminum hydroxide, look for ECG changes, correct vitamin D, IV calcium gluconate, initiate seizure precautions, underlying cause treatment, magnesium correction, and move patient carefully and monitor for signs of pathological fracture. So this was all about hypocalcemia. Stay tuned for easy explanation of other electrolytes in upcoming videos with Smart Mnemonics with SmartNurseGuide. Thank you.